This is Advocating for Racial Health and Equity at the Georgia Budget and Policy Institute. So a little bit about the organization. They really work to ensure that all Georgians have equitable opportunities. They propose solutions that are considered, that also consider negative effects on public policy, especially with people that have disproportionate impacts. And they want to do a lot of responsible and thoughtful analysis to improve the state's budget, taxes, public policy, things like that. So they take something like the budget, which sounds super, super boring. You know, who wants to study or look at that, and especially looking at taxes, and they make it really accessible. And they really put the value on, this is how our state kind of puts emphasis or importance on things by giving it money and funds to push it forward. So when we're thinking of all those public goods and how do we equitably put in solutions with public goods, this is kind of what they focus on a day-to-day basis. So here are some of their just basic core components and strategies that they do, conducting and disseminating research and analysis. And they put out a lot of policy briefs and issues on different issues, why they're important. They conduct strategic communications, and that is so essential because we have some really strong narratives in our policies and just a lot of thoughts throughout the nation in Georgia that are deeply embedded in racism. So they're really strategic communications plan and how do we overcome those stereotypes and narratives are important. Of course, building a strong organizational capacity and supporting and developing key partnerships. There's a lot of great organizations throughout the state doing this work or grassroots work that they try and bring on board and really rally together for. And so they like to break up some of their issues into kind of key subject matters that they focus on, which are going to be the stable and fair tax system, protecting the safety net, which is kind of economic security, educated youth and accessible higher education, healthy communities, and a strong workforce. And some of the newer areas that they're also looking at are a fair justice system and a welcoming environment for immigrants. But all of these kind of sub-issues all revolve around the budget. So now I'm going to discuss some of the core pieces and tasks that I did while I was at the Georgia Budget and Policy Institute. So I started June 8th, 2020, in there, which was a very turbulent time, emotionally time going on in our country, right during all of the racial protest and during COVID. This was also a week before our Georgia legislative session opened back up after being delayed back in March, which I don't know if that's ever happened, maybe once or twice or never. So that was kind of the cloud that I started this work in. So it was a very exciting time to be there, but emotionally charged time as well. And so at the top right, I have an image of their budget primer that they put out every year. So this is the one that they put out for the 2020 budget. And I was at their conference in January 2020, back before I had started or any of this, just to show you how much I was geeking out over their budget issues. And they just do such a good job of spelling out things very simply. So even I could understand who don't have a lot of knowledge on the Georgia state budget. So I'd encourage everyone to download that. I still have my little pamphlet, but I had the opportunity to work on the 2021 budget primer. So listening in on a lot of session hearings for the budget, kind of going back and forth for there. And I will say that it was exciting because there's a little bit of a political tide. I wouldn't say a total change in tide, that's too strong of ones, but we were able to broach a lot of subjects that were really shut down in previous years, such as Medicaid. It became a little bit more of like, should we look at this? Should we do it? Also things like raising the revenue, some previous bills like raising the tobacco tax, auditing the state tax breaks, things like that have been shut down pretty quickly in previous years. Whereas the last in 2020, it made it a lot further. And all of these revenue raising issues are so important because Georgia is actually one of the bottom revenue raisers in the nation when it comes to like per person per population. We raise the least amount of revenue. And so that means revenue goes towards public good and services. So we don't have a lot of public good and services that we're able to offer because we don't collect a lot of revenue through many different mechanisms. So that is always a great option when we're looking to bolster up our public services for everyone. So we were able to get a little bit further on those issues. But I wanted to touch on just kind of like a health equity win and a health equity loss that I took away from being able to listen into all the sessions and helping to contribute to the next budget primer. So the equity loss, I would say, what didn't occur during session, but was the new Medicaid waiver that was submitted federally. Essentially, that will eliminate Georgia's healthcare.gov, where people can go with a non-biased way to look at different healthcare options for our state. And they have passed that. So Georgia will be like the first in the state not to have healthcare.gov. I think it's next year or the year after that, unless it changes. And I would say the health equity win from the 2020 session was the Medicaid expansion for moms up to 6 months postpartum. So before that, women who were pregnant could have Medicaid access, so they could have their pregnancy covered and have a safe delivery, and they're only covered for an additional 12 weeks. But in that session, they got covered up to 6 months postpartum. And we know that when mom has insurance, the baby is also more likely to go see the doctor and get all of their regular checkups as well. So I think that's a really big health equity win, knowing that our infant mortality rate for Black mothers in Georgia is abysmal. And just to give you a little idea of how our state funds public health, we have 3 big health agencies in the state. It is the Department of Developmental Disabilities, I'm saying that wrong, but DBHDD, the Department of Community Health. So they have 3.4 billion, and then there's public health, which has a mere 284 million at the State Department, which is out of all of our state's total budget, 1.1%. So that's 1 penny on the dollar towards public health in the state. There's a little bit more for all of our health systems in general, but when we look at just public health, it's a penny on the dollar. So how we use those funds is so critical because they're so limited, and they have been going down over the years. We're funding it at a lower rate than even pre-recession. So back from like 2008, 2009, when we were at an economic high, we still haven't recovered back up to that, even though we know our economy was doing really well prior to COVID. We're just a very conservative state when it comes to raising funds and collecting taxes. Another piece of work that I spent a lot of time on was a policy brief. So we looked at the intersection of health and early care and learning centers, especially considering COVID and looking at the state of Georgia. So we reviewed how access to early care and education impacted health. A lot of early care centers really center around some health programs, whether it's providing access to food, nutritional programs. Some of them, like Early Head Start, even have performance measures to increase children's insurance rates of children who are in there, and provide wraparound services to connecting parents to health hubs throughout their community. They have parent engagement things. So all of those have a really good trajectory on the children's life and benefit to the family's health as well. So all that, in addition to just learning and having high quality supervision, we know it's essential for children and families' health throughout of our state. Some of the equity issues that we addressed within there was the funding availability for families. So we know 0 to 5 is such a critical window for early brain development and future success. School readiness by kindergarten. Learning does not start when you're 5 and in kindergarten, it starts at birth. So having that high quality care available for all children is essential. And just as K through 12 is a public good, we have deemed education a public good. We don't deem early education a public good, so it's not available to everyone. So out of the 364,000 children in Georgia who are income eligible to receive early care for free or subsidies, only half of those actually receive it because of limited funds and capacity. So that's about 180,000 children 0 to 4 who are in need of further assistance to receive high quality care in Georgia. Other things that we looked at was the opportunities for children by race and ethnicity to have access to it, because we know that some locations are centered around, they're not everywhere in Georgia. And then also we know that there's a big discrepancy in discipline, in school discipline K to 12, but that discrepancy also exists in preschool. So in preschool, we're seeing that Black children are disciplined more harshly and have more suspension and being expelled at higher rates. So children outside of school, the parents have to stay home then. They're not learning as much. Maybe they get meals there. So we want all of our children to be in schools as much as possible. Lastly, within this paper, we also looked at the disproportionate impact of COVID on low-wage workers and people of color who shoulder some of the most severe financial burdens and health burdens associated with COVID, but they were the first called back into work and are least likely to be able to telework. So having early care available is really essential in the pandemic, outside of the pandemic. And so for this, we had a big policy brief, and we also did a one-pager that was released. And within that same package, I also got to conduct a Facebook Live interview with the director of Little One Center. So one day, Akuran Meadows, who is one of our partners I work with at my full-time organization, but she's super awesome. And she even has a community garden that's attached to her early care center. And she really works to specifically source local food. And she even works with Black farmers. So she wants to reinvest within her community. So not only do the children coming there get something out of it, but she's able as a small business to support other businesses within her community. So she's just super intentional all the way down. I also presented for incoming legislators with Georgians for a Healthy Future and the Georgia Budget and Policy Institute and a couple other organizations as a collaborative. So we did a Public Health 101 presentation for them. And I honestly learned a lot creating this presentation and having been in public health, but to specifically look at public health systems as the state funds it and runs it, from the state level, the district level, and down to the local level. How does that funding trickle down? And also how do the services get spread throughout the state? So we focus on the budget of it, how it trickles down, a couple of the state's priorities and what they're doing, and then a couple of the local services that are offered throughout the state. And then also, of course, some calls to action for new legislators, how they can, have a public health mindset and some things to look out for as they're going forward, especially in a public health crisis. So we did that in December, and I was like Googling the people as we were presenting to them to see who they were and what their campaign skills were. So we really had a good bipartisan group there that we were able to discuss with, and they had a lot of really great questions. So it was great to see them really interested and engaged. Okay. And so another piece, I think this is the last one I'm presenting on that I worked on specifically. So the Georgia Budget and Policy Institute, while I was there, was doing a lot of work on building racial equity internally and externally and what it looks like and some action steps they're going to take. And one thing they decided to do was build out a timeline of many key issues to look at policies that have intentionally baked in racism into our systems and practices and policies. And it's easier to see, I think, without having so much history in grade school growing up, how it's all baked in and how we really intentionally have put it in there. And it's going to take a lot of intention to take it out. It's not just going to take, is this policy okay? But it's going to take some retroactive things to counteract it as well. So really briefly, I found this just super, super interesting as I was going through it to take this perspective of it. So I'm going to do just a couple ones quickly. So first, from African American, their health treatment was only in relation to their value as property. They didn't have any at all. And then even post-slavery in the 1890s, we see the Jim Crow laws in Georgia as well, put them right back there with total segregation. So they didn't have really any access at that point either. And not only was it no access, the Jim Crow laws prevented them from having essential government services that they paid for through their taxes. So they didn't have proper streets, sewage, lighting. So when we think of social determinants of health, how is your community? What do you have access to? In the 1900s, they did have the first Black medical schools open in the US, but at that time, like in 1910, it was 2% were Black physicians, and they did cater to that segregated ones. And even up until the 1970s and 80s, it was still only at 2% of Black physicians. And then we see in still 2018, 5% in the US, 12% in Georgia. So it's still a hurdle. One highlight story in 1918, the neighborhood union of Atlanta So this was a Black-led initiative, and really they were the first kind of public health. We think of John Snow as like the epidemiologist and the big public health history buff, but these women were really, I think, the first community-based public health people we should recognize, just like John Snow. And they looked at street lights. They went surveying around communities to see what they needed. So they built playgrounds because there are no playgrounds for Black children. They built a health clinic because there was no access there. They did boys and girls clubs, and they even had like a little junior league for them as well. So I think they're like a key public health icon that's Atlanta centered. 1915, the famous term snow-nosed lines, no color line. So this actually backfired. This was Booker T. Washington trying to say, even as a workforce, we need to provide better health care for Blacks. And they're advocating for them, but it kind of backfired into some more negative rhetoric and stereotypes. It just reinforced those at the time. Redlining, of course, I think is essential. And that is they were denied, people were denied house loans based on race of their community at large. So what does denying house loans do? It really denies us the ability to accumulate wealth and pass that wealth on generationally. So it prohibits that. So when we look at this big wealth divide by race, redlining has a big thing to do with it, especially in big cities. Not just wealth and health, but resources within the areas. If you have a low-income area, the resources or schools or supermarkets in there, it just has a big trickle-down effect. And we still can see the maps today when we look at areas with disproportionate effects based on where they were redlining. The Burn-Hill Act, this was federal money to build hospitals, but they could not be discriminatory. They could be separate, but they did not do a good job enforcing that. And then they could be separate but equal, and then they could not at all. But even up until the 1960s, this is an example in Alabama. So there are 67 funded hospitals through the Hill-Burton Act, and only 2 were for Blacks. So that is not separate or equal. That is not desegregated. It's not anything at all. So those laws were not truly enforced until Medicaid came along in the Civil Rights Act in the 1960s. So any hospital accepting Medicaid really had to show their non-discriminatory policies. And Medicaid is also a great example impacting equity because we saw women who had access to that or babies that were born access to that. For Blacks, the infant mortality rate really dropped, the low birth rates, babies dropped. So that was a policy that had a really big impact on infant mortality rate for Black women, which had a really big divide in that time. And then there's many, many more, but the last one I included just to show you how close in time was Grady Hospital was racially integrated in 1965. So that's definitely within many people's present memory. And it was a memo that was sent overnight with not a lot of training or structure around it. So you can only imagine how that process ensued from there without much guidance or leadership. And I think I have just a couple more minutes. I wanted to touch on some of the bigger things that were going on at the Georgia Budget and Policy Institute while I was there. So these are some of the things that I was able to kind of participate in a little bit. I wasn't tasked or the main workload, but it was really great to be a part of the racial, ethnic equity and inclusion plan. We had regular work group meetings and I served on the communications work group with them. But just to hear all of them, they have such, I think, a high level of knowledge and reflection. They put a lot of space in their work to reflect on this, and it really shows in their team's collaborative process and how they review any document, any communication that goes out. And I would say that definitely before 2020, I think they were doing that when it wasn't as popular yet or well received by parties in the state. But I think, you have to be the first to go out there and say whether it's popular or not, because if it doesn't get said first, it doesn't get second, third, or fourth, or, grow to be bigger. So they're definitely at the front end. But what they did is really operationalize what this is going to look like for their agency internally, the steps they're going to take as individuals, as professionals, as an organization, and how they're going to translate that out to the bigger community. So it even means training their board, including all of their narratives that they're putting out there, training their partners in it, and maybe not partnering with everyone who invites them to partner based on what's going on, or even funding sometimes. And I wanted to give you 2 examples of some of the really great pieces of work. So here I have internal work, communications, narratives, research, advocacy. I'm going to show 2 really great examples that I'll put the links in the chat box in a minute for research and communications. So one of the research pieces they put out at the end of last year, everyone, this is a really great weekend read. So this is Cash Matters, Reimagining Anti-Racist TANF Policies in Georgia. And TANF is kind of the cash benefits acronym we use to give low-income working families in Georgia. It's very hard to qualify for this. You have to have $1,000 or less of assets. So if you have a car that's over $1,000, nope, it's very difficult to get it. So it's not just going to everyone. There's a lot of barriers around it. So at the top here, I have increased TANF funds for cash assistance. So we receive federal dollars, TANF dollars to provide cash assistance, but sometimes the states use it for other things. Georgia as a state uses TANF dollars, which could go as cash assistance to needing families, instead goes to other programs, which we could be using other state money for. So they're not using all the cash dollars to give out directly to families. They're kind of keeping it, and they're doing all of these budget cuts and just kind of absorbing that TANF money and putting it other places. That's what we like to do. So keeping that money directly for families as possible. Repealing the TANF family cap. So the family cap means that we're only going to fund families up to so many children and not beyond. And we don't fund children who are born while their mother is on TANF and then she has another child. We don't fund them anyways, but we only fund a certain amount. And the family cap is really based on some racist rhetoric about the welfare queen that was started by Reagan, and also some other ones trying to control unwed mothers from having more babies. So keeping that family traditional structure strong. So it's rooted in those type of rhetoric. Also eliminating the TANF the asset limit, which I said was only $1,000. So how do we expect families to accumulate any type of wealth or build that self-sustainability, which is having a personal safety net, not being one medical bill away from back in poverty. So we want them to be able to accumulate those things or not have to get rid of whatever assets they have to qualify for it. And then also repealing drug felony bans, because we know the disproportionate people who are arrested, incarcerated, and charged where drug deals are Black. And so it's further penalizing them from receiving assistance when needed. So this paper really goes into the many different ways that we have reflected our racism within policies, especially towards giving out support to those who are in need of it and lifting them back up. So I would definitely encourage that read. And then the other one I just released is a communications piece of how we could better frame discussing supportive policies for families in Georgia. So I just discussed a little bit about like the social welfare queen, that trope that she was defrauding the system, and it was a Black woman that Reagan plastered up there. And so that was what was in everyone's mind. And there's research studies that shortly after that, when they talked about who was in poverty, people largely thought that it was only Black people in poverty, when we know it's more white people, even though it's disproportionately Black people. So having that narrative in the head really affects the whole conversation going forward. So in here, Caitlin and their team did a lot of great work on surveying people throughout the state of kind of the notions and thoughts they had about social services and social supports in here. So this first one, the concept of the deserving poor and the undeserving poor should be turned on its head. So opponents claim that some recipients of economic aid programs like veterans or elderly are deserving because society created the circumstances versus someone else who created it for themselves because they're lazy, because they don't have motivation, because they're not working hard enough. All those other things that I think narratives have told us throughout the media and other ways. Instead, spreading narratives that poverty is systemic and caused by many, many issues, the least of which is individual, and that poverty is a public health crisis and it is a policy choice. So That one is also really good from the Georgia Budget and Policy Institute, because I think until we turn around some of these narratives, we're not going to be able to get everyone on board to tackle and break down these barriers. Okay. And that is my time at Georgia Budget and Policy Institute. I think they're just a very inspirational group. Go to their website today, download at least one. They just put out a really good one on Medicaid. And since it's legislative session right now, it's really applicable to everything's happening. So they're putting out stuff right now that you can go and reach out to your representative and put your 2 cents in as a public health professional or what, just as a citizen of Georgia, and be a participant in that way. So thank you. I'm gonna look at the chat box, or if you guys have any questions, feel free.
Thank you, Jyll. Actually, if you want to maybe unshare, and then if folks have questions, you can either raise your hand. Looks like I see clapping from Dr. Lynn, so thank you for that, Dr. Lynn. Either raise your hand in the reactions, or put a question in the chat box, and I can keep an eye on that, or just shout it out.
And I saw my mom on, but I promised her that she could not ask questions, or she promised me that she would not ask questions. So. I'll put the links in the chat box now.
So Jyll, I have a question for you. You know, your day job is involved with some of the same populations that Georgia Budget and Policy Institute targets in terms of trying to lift them up. But your day job doesn't really include direct policy and advocacy work. Are there ways in which this experience kind of informed what you do in your day job?
Yeah, so as a state employee, and I know there's other state employees on this call, it's important to know that we can educate. We can't tell people how to vote, or here's a policy, vote this way on it. Here's a bill, vote this way on it. But we can definitely educate about different things. And I think being bolder to, maybe we have stayed away from saying Medicaid. Maybe we have stayed away from saying things that we know aren't popular in Georgia, that, you know, we don't want our organization, people to frown away or take a step back from it, so I work at Prevent Child Abuse Georgia. So we don't want people to take a step back from child abuse prevention because we're talking about Medicaid, but I think we should be emboldened to talk about these things because it's all really related. You know, social determinants of health are a web that affect the well-being and the ability of families to thrive. So we should be emboldened to discuss it and state why. And they do such a great, clear job of connecting those dots that I don't feel as, I guess, anxious to say these things to groups of people.
That's great, thank you. So Sophia, who happens to be taking my policy and equity course this semester in the master's program, asked about how you reached out to legislators and policy leaders and what it looked like in terms of taking that issue brief that you put together about early child care, and got that in front of state decision makers.
So the Georgia Budget and Policy Institute sets themselves up as subject matter experts. If you're on their website, they do a great job of policy topics by expert or by subject. So already poising themselves as someone that legislators might come to. So they do have a lot of legislators who go to them for issues. They're not health experts, or they're not education or tax experts, but they do trust the GBPI. So they go to them, hey, what is you guys' take on this? I know you already have a lot of resources. So it might not be something that is used in that exact moment all the time, but they can pull it out when the time is needed, or someone is always coming back to them when something becomes an issue. Like Medicaid is now being talked about a lot more, and they have so much research that they put out over time that they can just easily grab when it's time. So less than it's in that moment, but they're ready.
Thank you.
And answer it.
Yeah, so Rachel, who's also a MPH student, is wondering how you managed to do the applied practice experience and maintain your day job, and how that worked in terms of kind of juggling hours to, continue your day job, but get the hours in required for this experience.
So I was super wondering that as well. I did mine all virtually. Obviously, when I reached out to them in like May of 2020, I'm like, hey, can I do a practicum? And their response was, well, this is a weird time. And I was like, yeah, but can you take me anyways? But I think it worked out really, really well because all of the legislative sessions are live streamed. So you don't have to go there. You do miss some kind of personal networking connection by not being there in person, but I could watch a lot more. And I could also participate a lot more in their activities because they don't just occur in one day. So if this wasn't COVID, I'd probably have to work 40 hours a week, 4 days a week at my full-time job and do 1 day a week at the Georgia Budget and Policy Institute. And then also some weekend hours. But being able to just attend some of their meetings during the day and tack in hours to my work was really good. I mean, I don't think it took too much of my workday hours. They have like 3 hours of staff meeting and then a couple other triple things, and the rest I did at night on the weekend. But it was really awesome to be able to be part of more since it was virtual. So I don't know what it's going to look like for you, but if we're going to get back in person or not.
Yeah, and I would say in general, when you develop a proposal and scope of work for an applied practice experience, part of that conversation has to be about the logistics of coordinating times and hours and making sure that's going to work. And some sites, agencies, organizations have more flexibility than others. Obviously, in a virtual world, less issues around transportation and going from place to place. And but that's very much something that has to be kind of individually sorted out to make sure it's a potential option. Any additional questions? Lots of thank yous and great presentation, obviously to you, Jyll, and I would echo that. Thank you so much for sharing your experience. And again, thanks so much for everyone for joining us. Rachel, did you have another question? I see your.
Yeah, I just wanted to say thank you to Jyll. I'm Rachel Shanklin. I'm the Georgia Outreach Manager for Small Business Majority. So I work really closely with GBPI. So I actually reached out to Amanda Hollowell before I even knew about this event, and she spoke really highly of you. So I just wanted to say it's great to connect, and I really enjoyed the presentation and looking forward to hopefully doing my applied practice experience with them.
Yeah,
terrific.
Tidal wave. Thank you, Rachel.
Thanks so much. And just as an aside, you already have that relationship, but if you need me to connect you with David or Laura or anyone else, happy to help with that.
Thank you.
Yeah. So thanks everyone for joining us. And again, thank you, Jyll, for the presentation.